have just categorized them so that it will be easy for you to remember the drugs or to study the drugs. That's why I have categorized this. This is not a strict categorization. So let's move on to the therapeutics. So first category, sensitivity to pain. That is my first category. That is, the patient cannot tolerate touch, or the patient is very hypersensitive to pain. So under this category, I have included 4 remedies: ARNICA, BELLADONNA, China, and CALICA. So let me tell you some points about each of these. First is ARNICA. As you all know, ARNICA, not only in gout, but in injury or in acne or in anything, they have constant fear of being touched. That is, even if another person brings their hand close to the painful part, they will have that fear that it is going to cause them pain, and they will not allow that particular part to be touched. That is very important sensitivity of ARNICA in any complaint. Then another point is bed feels too hard. Like wherever they lie down, they'll feel that it is, the patient will have sore bruise feeling all over the body. They cannot bear the pain. They will be constantly moving about in the bed to find some soft spot. That is the sensitivity of ARNICA. The patient, he will feel that the bed is hard and he's very restless, moving around to find a soft spot. But motion is aggravation factor for ARNICA. That is, during motion, the pains increase. Actually, the pain is aggravated during motion, and lying down also, the pain is aggravated. See the modalities in ARNICA: aggravation motion, aggravation lying down, cannot bear the least touch. They are very sensitive. Then again, this modality is also important. Pains are unbearable during night. You can think of ARNICA during acute episode as well, but ARNICA need not be repeated frequently. Now, if you go to the location and sensation, the knees in ARNICA are affected. It may be first difficult for you to remember all the location part, but it is important while selecting the remedy. The knees are swollen. The patient has to bend the knees while lying down. The toes are swollen. The whole foot is immovable. That is about the location and sensation in ARNICA. So remember the constant fear of being touched, the bed feeling too hard, or the patient will say, I can't lie down. It is difficult for me to lie down. It causes pain. Wherever the bed touches me, it causes pain. Then pains are also unbearable during night. The second remedy is BELLADONNA. Belladonna acts very well during acute inflammation. So, and you know, belladonna is having features of typical inflammation: redness, swelling of joint, etc. And the characteristic pain of belladonna is the burning pain. Not only in gout, even if for patients with low backache or any joint pains, belladonna acts very well during the acute stage. If you give it in, I usually give it in 30 potency, dissolved in water, frequent repetition, and you can see if indicated, not in all cases of acute pain, only if the modalities are the important thing in belladonna. That is, the patient cannot bear any motion. This is actually jar spelling mistake. Touch, jar, motion, all that is unbearable to the patient. Jar, if the patient is lying down or sitting on a bed or a sofa and somebody else comes and sits there, the patient will feel the pain in that particular part. And it is clinically verified also. That modality, if you find belladonna acts very well in, I give in low potency, frequent repetition. And aggravation lying down, again, like ARNICA, aggravation lying down, aggravation night, and burning pain. The patient will say, I feel that joint is burning, or I feel heat in the joint. That is about belladonna. And sometimes the patient may also have headache. They can tolerate light, headache they will have along with the pain. Next remedy, China. China, again, is sensitive to pain. Aggravation, contact. even by simply approaching the hand, just like ARNICA, even by simply approaching the hand, the patient will feel the pain by contact, by slightest touch. But here the patient will have amelioration by pressure. If you press the joint hard, the patient will have amelioration. And then here, another important thing is open air. Not only open air, any fan, if you switch on the fan or AC or whatever, cold air, that is intolerable to China. So that is important modality. This dread of open air is peculiar to China. Now, joints affected, if you look, they have swelling in the lower extremities, mainly knee, ankle, and foot. Next remedy, CALB. CALB is usually given as a chronic remedy, constitutional prescription. And as you can see, it prevents relapse. So after the patient has, the acute attack has subsided and the patient has that lingering discomfort, during that stage, you can give CALB. And I usually prescribe CALB in 200 or above, single dose. And then wait for the patient to react. And then repetition is always based on the the second prescription, or the repetition is based on the symptoms again. You can't say how when to repeat now itself. First you give a remedy and then check what symptoms the patient comes up with. Then only you can say whether you have to repeat the same remedy or you may have to give an intercurrent or some other remedy. It depends on the patient's symptomatology. So in CALB, there will be pain, the modalities. First, let's look at the modalities in CALB. In CALB, there is aggravation touch. The patient cannot bear to be touched. That is the sensitivity. Especially foot is very painful when you touch. Then again, aggravation rest, lying on affected part like ARNICA. Here again, you have CALB. Aggravation cold weather. Cold weather is intolerable to this patient, whereas warmth gives some relief. Okay. And another feature of hypersensitivity to pain is that the pain will make the patient irritable. He'll be very angry. That pain, like bryonia. Bryonia is not, you may give it in gout, but it's not a specific remedy for gout. But if you compare this irritability, bryonia patients, when they have pain, a fever or in pain, they don't like to be disturbed. They like to be let alone. They become irritable when you disturb them. Same way. Now, some of the other complaints associated in CALB, they may have migraine along with nausea. Then flatulence is every